All right. Welcome to the third week of the first module. And this week, we're going to be discussing aging differences between sexes, um, which is really just comparing how aging affects females versus males. So let's take a look at our learning objectives here to start. So by the end of this week, we should have a good understanding and be able to identify which sex lives longer, and the related theories involving why that sex lives longer, differentiate aging changes between men and women, both on a chemical and biochemical level, as well as a physical level as well. We're going to describe the age-related changes of the reproductive system in men and women as well. So what are the differences as far as the reproductive system goes? So essentially comparing how things differ between men and women as far as aging. So when we look at the battle of the sexes in terms of longevity and life expectancy, we see that women definitely have a longer life expectancy than their male counterparts. And this is interesting because although we see a birth rate of 105 males to 100 females, so a birth rate that favors males, because of the higher mortality in males, it's about 25 to 30% greater than their female counterparts. We then see that ratio at birth shifts in infancy to then favor females and then favors females onward. So essentially, although there are more males born than females, because of a higher infant mortality in males, we see higher prevalence in society of females, so there's more females, and then we see them living longer as well. So there's definitely some genetic component that is responsible partly for the higher male mortality that we see in infants. As far as in developed countries, economically viable countries, we see that women definitely outlive their male counterparts. The worldwide gap in the life expectancy is about 7 years between males and females. So at birth, it's about 79 for females and about 72 for males. So at birth, it's projected that a male would live to 72 and a female would live to 79. So that is the statistics for developed countries. As far as worldwide averages, the gap is slightly more narrow, but there is an average of 81 for females and 76 for males. So there is still a gap in terms of a worldwide average between males and females as well. So what we see is that more males are born. For some reason, males have a higher mortality at birth, and then we end up having a shift in that ratio to favor females throughout the rest of the lifespan. Now let's talk about some theories as to why that may happen. So there are several components or factors or reasons that may be thought to explain this gap between the lifespan of a male and the lifespan of a female. The first and probably most obvious one is the genetic factor. The theory is that there are certain genetic components that offer protective mechanisms, such as reproductive hormones. We know that women have estrogen and progesterone, at least in much significantly higher quantities than males. And those hormones tend to offer a protective function as far as things like heart disease. So before the age of 50, when a woman is still producing estrogen and progesterone, she has a protective measure because of those hormones from things like strokes, things like heart disease. And so that's one of the theories that seeks to explain why there's this protection associated with the female biology, and hormones is a specific part of that. The second factor is males being more risky. So throughout history, males tend to participate in more risky behavior, both in a behavioral or in a risky behavior in terms of like smoking, drinking, and other risky types of activities. Males also tend to have more risky or dangerous jobs. Think about driving, heavy machinery or anything like that. Just jobs as well as, you know, other behavior that would be more risky than some of the jobs and behaviors that we see associated with the female roles. And that is traditionally. The third factor here is women have two X chromosomes. So because males have an XY and females have XX, it's thought that there's a backup of a certain pair of genes in the case of any type of mutation. So that is thought to kind of protect women again from some of the mutations in genetics. So let's say you have a mutation in one of your genes. Because you have two X chromosomes, you essentially have a double pair or a backup pair of genes if there are any mutations on either of those. If you're a male, you only have one X and one Y. So if you have a mutation on any of the genes on the X chromosome, you don't have that backup. And so this is the theory that kind of seeks to explain, again, those protective mechanisms that are associated with the female biology. So the presence of two X chromosomes. And then fourth, the theory here is the biological variation theory. It's thought that this is just simply a unique human trait. This is something that is just going to exist all the time. There will always be a gender gap. Although humans are one of the only species that have a significant post-reproductive gender gap, this is the theory that this is just this biological variation. It's just as a human trait that is observed in the human species. Now, I want to point out here that there is the fact that this does not support evolution. The fact that if genes rather than the environment were responsible for lifespan, then we would not see any changes in the gender gap, and we have been seeing changes in the gender gap. We'll talk about that in a little bit, but if this were just a constant human trait, we would expect to see it. We would expect to observe it continually throughout the history of the human lifespan. And we know that it's actually changing, it's actually evolving. So we can kind of rule out that fourth theory, the biological variation theory. And we'll talk more about some of the ways that the gender gap has been narrowing and how it has been evolving over time. So here is the gap in human life expectancy. This is the gap at birth at the top here, and then this is the gap at 65 years of age at the bottom here as well. What we're also comparing is how the gap has been changing. So what we saw is that between 1950s to 1970s, we had a larger gender gap between males and females. This was the life expectancy at birth. So if an infant was born during these years, it was expected to live to 67 if it was a male and to 74 if it was a female. So that's about 7 years or so in terms of that gender gap. What we see is that if an infant was born in the 2000s, so if an infant was born in recent times, that gender gap is significantly narrowed. So that infant would be expected to live to 77 if they were a male and to about 80 if they were a female. So we can see a smaller gap here and shows us how this gap has been narrowing or how it's been changing over time. Now at the bottom, you can see a similar narrowing of the gap between recent years and the 1950s to 1970s. We can see that the gap, now this is the expectancy at age 65. So if you were to look at a 65-year-old male or female and talk about their life expectancy, how many additional years that they were expected to live. If they were 65 and they were male, they were expected to have additional 13 years. If they were 65 and they were female, they were expected to live an additional 16 years. So there was a gap here as well. And then if we look at that in more recent times, the gap has narrowed to some degree as well. So overall, the life expectancy at birth and at 65 has showed a steady narrowing rate in terms of the difference between what females are projected to live up to and what males are projected to live up to, okay? And so in 2003, the gender gap had shrunk, and this is the overall worldwide average, to 2.6 years, and that is comparing women at 80.1 and men at 77.5. Next, we'll look at some of the physical differences, some of the differences that we see in terms of physical signs of aging in men. And then we'll follow that up by talking about some of the physical signs of aging that are unique to females as well, or women. So males who lead unhealthy lifestyles are likely to exhibit cognitive impairment. And this basically means that the risk factor for cognitive dysfunction in elderlyhood, for males, that is going to be an unhealthy lifestyle. So think about chronic disease, especially non-communicable diseases like diabetes and hypertension and heart disease. Those are the risk factors that we traditionally see for cognitive dysfunction in males. There are different risk factors for females that we'll talk about. Male centenarians are usually in better health, so that's something kind of interesting. If a male and female live to become centenarians, the female is usually in poorer health, the males are usually in much more pristine health than their counterparts. The difference in the end to fertility, so men do not experience an abrupt end of fertility. They show an age-related, sort of a gradual decline. This phenomenon is called andropause, so it is this gradual decrease or decline in function that is associated with male fertility. So it's not as abrupt as menopause, which we'll talk about in a bit. This typically occurs anywhere from 40s to 60s in males. Now, traditionally, we don't see male sexual performance being affected unless there's some type of medical condition or some type of disease process, again, like cardiovascular disease or hypertension. But traditionally, even through age, men tend to retain their sexual performance or their sexual function. As far as muscle mass, men show a decline in muscle mass at a rate of about 2% per decade, which differs significantly for women. So women, the risk factors for cognitive impairment in women tends to be a life where there was significant dependence on others. So if there was family dependence or spousal dependence, that tends to be the risk factor for seeing cognitive dysfunction in women, as opposed to unhealthy lifestyle or chronic disease as it was for men. Again, we said, although women are more likely to become centenarians, they're usually in poorer health than their male counterparts, which I guess speaks to the resiliency of the female body, the female physiology, that they could live longer, even being unhealthy. Women tend to experience an abrupt end to their fertility. We know this as menopause. A woman is thought to be born with the exact number of eggs, and when that pool declines, or when that pool is exhausted, then a woman enters a phase called menopause. This is usually around 40 to 50, and this is when all the available eggs have been exhausted, and so essentially she loses her reproductive ability. There's also an increase in the rate of bone demineralization or bone loss that's led to osteoporosis, which increases her risk for fractures. The uterus tends to atrophy, so do the ovaries, because of the loss of the cyclical hormones that are associated with the menstrual cycle. There's also a decrease in female hormones. We talked about estrogen and progesterone. These two hormones offer women a protective measure in terms of cardiovascular disease and vascular disease in general. So when there's no longer the presence of these hormones, then the risk for cancer, for heart disease, equalizes between males and females beyond the age of 50. And then lastly here, we see that there's a decrease in vaginal secretions, which may present a painful sexual experience, so that in itself may decrease sexual function. And then lastly here, we've got a slowed rate right? We saw 2% for males in terms of the rate of muscle mass decline. It's a bit of a slower rate for females. So it's about 1% per decade. But if we look at the overall picture that males tend to have a larger proportion of skeletal muscle, then this is kind of a consistent or an equal weight overall, okay? So females start off with less muscle to begin with, but they lose muscle at a slower rate. Males have more muscle proportions overall, and then they lose their muscle mass at a faster rate. And lastly here, we're going to talk about some of the features that males and females share. So things that men and women show similar in terms of aging. The body weight increases. So this is the traditional, weight with age that I'm sure have heard about in our own lives or have experienced or seen in other people. But there's a certain amount of weight, it's about 15% that is added with each decade. So between 20s to 70s is about 15% in terms of that weight increase. And that is actually equalized between men and women. So that's something that they share in common. And that is because of the fact that males start with more muscle and they lose it at a faster rate, and women start with less muscle, as I mentioned, and lose it at a slower rate. So that kind of equalizes the body weight increase in terms of muscle being replaced by fat and aging. Wrinkling of the skin happens at a similar rate. This is caused by loss of skin cells, loss of some of the subcutaneous fat that keeps the skin adhered to the underlying muscle and bone. And so when we lose that, we see this increase in cross-linking of the collagen, and that leads to skin wrinkling. We also see loss of some of the senses, so loss of hearing, which we call presbycusis, and decline for near vision objects, which we call presbyopia. There's also a decrease in the GFR, so the filtration rate of the kidneys because of a loss or decline in blood flow to the kidneys, decline in the immune function. This leaves the elderly or people as they age in general, leaves them more susceptible to infectious diseases, but also kind of decreases or dampens their ability to defend themselves from other types of disorders as well. And then lastly here, the genetic quality of gametes, which includes sperm and eggs, tends to decrease in its quality or function. The quality tends to decrease. So these are some of the things that we see that are consistent or the same between men and women. And we'll talk more about the physical signs such as frailty and so on when we move on to the third module, where we look at the structure and function of aging. Okay, so that is all in terms of the content here, but I want you to have a look at some of the articles that I referenced for some additional reading. You can also look at outside articles that have not been referenced. You can look at magazines, or you can look at the text that I referenced for the slides here. And I want you to reflect on why you think women live longer than men, why you feel the gender gap between men and women has been closing, and then talk about some of the age-related changes that are seen in the reproductive system and how those differ between men and women. All right. Remember that this week's discussion is a video or audio discussion. So you will have to record yourself either with a video or with an audio file and upload it, or you can do it right in the text box in Brightspace as well. If you're having difficulty with that, please reach out to me.